Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hello, everybody. I am Dr. Mary Ann Pinkston, and this is The Better Life with Dr. Pinkston. And as usual, I am going to bring you a great set of information on integrative medicine for all those who are curious about some of the new hot topics out there, like longevity. And today is going to be one of those days. And I am thrilled to bring you, and honored to bring you, a cardiologist from Canada, Dr. Anmol Kapoor. Excuse me, I'm notorious for that. And Dr. Kapoor, I am so happy to have you on the show today to talk about some of the wonderful things that you are doing out there in regard to longevity. I know you've got many, many things that you're doing, but we are happy to talk about longevity and regenerative medicine and all. And so welcome in. Thank you for showing for the show.
Thank you so much for having me. And I'm a cardiologist practicing in Canada, and by default, a longevity doctor, because my job is from day one to help make people live longer. So bring in any medical therapy or surgeries or whatever they need. But the science has moved since that time. I finished my cardiology training, and there's a new things on the horizon, new knowledge we understand. We have better understanding of omics and the human health and the body, how it interacts. So I'm super excited about this field and hoping people hitting 100 plus years and everyone living longer and healthier.
Well, not just, longer and healthier, not just the quantity of life, but the quality of life. And I think that's where everybody is now looking. You know, the traditional model, contemporary model of medicine that we have now is really not set, I think, to the tune of living healthier, and that longevity model is just, let's get people to a certain time and hopefully usher them out as well as we can. But I think the more integrative longevity, more regenerative medicine model is so much more helpful. But the problem is, I don't think the contemporary model really supports that. So I feel like we're fighting an uphill battle from time to time. I don't know if you find the same thing in Canada, but sometimes fighting the uphill battle. So I applaud you for taking on this role and being so passionate. How long have you been in practice?
Well, I graduated from University of Manitoba, Winnipeg, 2010. Did my medical school in Russia, my internal medicine training in Edmonton, cardiology, Winnipeg, then the vascular medicine certification in Cleveland Clinic, Ohio. From there, I came back to Canada and did my first startup in cardiology and started working in a highly marginalized area in Calgary, highly dense, low socioeconomic status with a significant disease burden from a cardiovascular perspective, and early mortality in that patient population, and lack of resources and education. So spent my time there with them, raised their issues, minority issues, refugees, women health challenges happening. And from there, I realized that the system is system, and system has to follow, and it has been designed as an average system. So we have to cater to an average healthcare provider or as a service receiver, and there are people who are exceptionals, and the healthcare system is not designed for those exceptionals who truly want to prevent disease and deep dive into their personalized health. And most clinical studies and trials, they do come up with the same generic one-glove-fit-all approach. So we were talking about personalized medicine. We always talk about cardiology being the leader among other leaders in medicine, including oncology. And we were one of the few to adopt personalized medicine in hyperlipidemia, high cholesterol, with the PCSK9 inhibitors. But then we never took an action as much. We know that aspirin, every 7th or 10th person on this earth is a non-responder to aspirin, right. But we're still giving aspirin 81 milligrams as a cardiac patients. I've been doing that for over a decade now. And many people are getting statins, and some respond, some don't respond at all. And despite being meeting all the LDL targets, they're still having a progression of their coronary artery disease, the blockage of the heart arteries. And many times patients will come to me and say, look, Dr. Kapoor, I did everything right. Why did I end up getting heart failure at a young age? What happened? And I cannot explain. No coronary artery disease, and there's for whatever reason, there's a heart failure. And we used to call them idiopathic, essentially meaning the doctor's an idiot and the patient's pathetic. So we have no clue. Exactly. So I was tired. I was tired of this medicine in a way. Yes, it served the purpose. Evidence-based medicine served the purpose and brought us to the level where we were able to expand human life and reduce cardiac event and death globally. Yes. But we hit the peak. And in many countries, the trajectory is moving in the wrong direction. Yes. And that's where omics came in play, the whole genome sequencing, microbiomics, epigenomics, proteomics. So all those cutting-edge sciences became much easier accessible. So we invested money into those areas, established one-of-a-kind multi-omics lab in Canada, in Calgary, started to learn how to download these analyses, how data, how to analyze them, how to connect them back with human health, and help provide answers to patients, like why they have the disease, at least why they got the side effect from the drug, why they didn't respond to the drug, and what is the right strategy or plan for them. So that allowed us to establish a company, BioArrow. Arrow essentially is targeting the biology, bioarrow.com. From there, we felt that longevity population is a population who was very focused on preventing the disease. Yes. And they want to make sure that diseases don't happen to them. They want to delay the onset of diseases, and they're very committed. So we established a company called Longevity, and we opened up world's first longevity clinic in Dubai, UAE, and from there we're looking to expand into America, Canada this year, with improving access to cutting-edge scientific innovations. We'll be also speaking at the BioBoston next week at a conference, unveiling some of our technologies there, where we can we already have the world's fastest genomic platform. We can do whole genome analysis and with a clinical grade reporting in less than 5 minutes. It's very, very fast, highly accurate, and we are upgrading this technology further, unveiling it next week. We want people to be empowered, people to be able to decide, be the master of their own destiny. And we want to make sure access is available for them on demand when they need it, when they have to decide about their family, about their own health. So we want to make sure we bring those tools in people's hand at a fraction of the cost.
Yes. Big cost and efficiency are sometimes not very well aligned, but that is absolutely wonderful. And I wonder, as for this question I want to throw at you, I know is for kind of a broad topic that would take us several shows to get through. But I think cardiovascular disease being in America the number one killer, most people enter in a little bit late for their health care. They enter in from a contemporary side, maybe taking statins, as you say, that kind of a one-glove-fits-all effect or whatnot. Many different people in my audience, generally about 35 and older, are looking for a little bit different way. And so how does somebody enter in and look at their healthcare? You can go on Google all you want to, or ChatGPT, and look up your health, which is what most people do, and look up your design for your healthcare. But how does somebody begin to look at cardiovascular disease and prevention and try to take a hold of it from their end?
Well, listen, knowledge is power. Knowing is power. Yes. I will always tell people now to start from a whole genome sequencing first. That's a blueprint of your life. If you don't have that, it doesn't matter what house you're going to build on it, it is going to crumble. Right. And then you add microbiome, the gut microbiome, yes, with that, because a lot of diseases are linked with it. We already have established many pathogens have been linked to coronary artery disease in many patient population. Articles have been published in prominent journals recently. And then I would add on various proteomic testing to that. So that involves ApoB levels, LP(a) levels, genetic LDLs, and a bunch of other parameters, which are common ones, high-sensitive CRP, to make sure there's no underlying inflammation in their body. Because we all know when we get old, it's inflammation that kills us.
Yes.
It's underlying inflammation, which is subacute, which we cannot detect, which cannot measure, and it's slowly eroding our health and causing chaos with our immune system. So it's like a water damaging your home slowly, and you don't see that, but suddenly you realize that the walls are falling down, the paint is peeling off, and it's exactly the same way. We have underlying inflammation, so it's very important to measure it and find a way to slow it down. Yeah. Obviously, I would recommend people to consider doing their cardiac assessments to make sure that they don't have any heart disease today. Yeah. If they have it, make sure they're getting the right treatment strategy based on the genomics, and also want to make sure that they have the right nutrition plan. Many times people think they're eating healthy. What is healthy? Everyone defines a healthy their own way. So to me, the healthy defines that's based on your gut microbiome. Diet and nutrition plans are made for you. But at the same time, making sure you have no underlying disease. If you have underlying disease, if it's diabetes, high blood pressure, any other chronic conditions, make sure you address them with existing evidence-based medical strategies. Okay. And then you add on other layers to make sure the other conditions don't manifest later in your life. If you have diabetes, make sure your kidneys are okay. Make sure your eyesight are okay. So you want to make sure you protect your whole body and talk to the people who can guide you. Yes, ChatGPT is a great tool. I'll use it every day. It is kind of a second coach or third coach or a third friend or a fifth friend you have where you want to talk to them and get little ideas. Yeah. But they could be wrong too, like your friends, your doctors do. So I want to make sure that you talk to the experts, professionals who have a lifetime experience and understanding how the human body reacts, how the human body goes through that. Yes, ChatGPT and other AI tools can give us insights, but they don't have an experience following a human and watching a human health crumble at a population level. Yeah. So yes, use them, but make sure don't abuse them.
Yes. Thank you. I needed you to say that. I think many of my patients are, using these tools much because they cannot go to their doctors and get the information that they need. And I think that they will be sidetracked by, these tools because they can't get it straight from their physicians. I can't tell you how many times I see patients who will transfer over to me with a set of labs that are truly lacking in inappropriate information. So like you mentioned, the ApoA, ApoB, some of the other factors for cardiac disease and other diseases are excluded. It's just an old, Framingham equation, that a lipid panel that is there. Sometimes they barely even touch a hemoglobin A1C. Again, it's that one glove fits all mind. And so those are things that we can do. Those are things that doctors can access, even with insurance, which is the primary model here in the United States that everybody, that everybody depends on, all patients depend on. Does my insurance cover it? Well, those things are widely covered now, and patients need to advocate for themselves and ask for these things. It is widely available. Thank you for making that point. The other point you make, too, about genomics. Now, that may be a point where patients may have to pay mostly out of pocket, but help explain, please, how important the genomic, you did for the most part, but how genomics might play an even larger role than just the few labs that most physicians do, and why they should reach out and do this, cost or no cost covered.
Exactly. So cost or no cost is your life, and every human being, even if at birth or whenever they have a chance, they should get a whole genome analysis done. Whole DNA is your blueprint of the blueprint. It has analysis of over 20,000 genes, and those mutations that could be linked to various disorders. And those are the genes you have inherited. We call it germline inheritance, and it doesn't doesn't mean they're going to cause a disease, but at least you know it. And I'll give you few practical examples how it works. So imagine if I have a BRCA1 and BRCA2 gene. It is widely linked to breast cancer in women, but in men, it has also been linked to prostate cancer. If I have that mutation, obviously my doctor will now need to make a proper plan and monitor my prostate health much more closely. And if I happen to have a bigger prostate, it will trigger them much faster evaluation instead of just using a watch and wait approach, because they will realize that with BRCA1 and 2, my prostate cancer could spread very fast. So that changes my practice for my own body or my own human health. And if I have a condition, let's assume we have a condition for breast cancer, and if someone has a lump and they go for mastectomy or lumpectomy, they are given a drug or chemotherapy. And many times we have seen, and the women often end up getting saved from breast cancer, but they end up developing heart failure. And a whole genome analysis can tell us not only about BRCA1 or 2, but also tell us about pharmacogenomic analysis. We understand the type of mutation they may have in the genome, so the drug they're getting given by their oncologist may be toxic, or maybe they have to lower the dose of the drug for them, so they could be saved from the breast cancer, but at the same time not die from the heart failure. These are a few examples I can give you why whole genome sequencing is the foundation, is the cornerstone of the human health. Everyone should do it. It's only one test lifetime. And we know that the gene interpretations are changing over time. New research is getting published and new analyses are coming in. Many times we define a gene as a pathogenic today, or sometimes we say gene is a likely pathogenic. It means a likely may cause a disease. So that criteria is well established. Depending on the well-published research, that criteria keep changing. You think of this way, when the COVID happened, we realized that there's a Delta variant, Omicron variant, some is going to cause a huge problems. So those variants keep changing and they're getting upgraded to downgraded situation. So exactly the same way, the genes can get upgraded or downgraded. So if you have it in your whole genome analysis, today a gene has been defined benign, could be defined pathogenic in a couple of years with the new research getting published. Right. So what I recommend people is download your whole genome, have your raw file, and a company should be able to provide you a free reanalysis at least once a year. Right. So, because the databases should be getting regularly updated with the literature. Wonderful. And getting free analysis, or at least paid analysis if you can get. So now ask them to reinterpret your data again, because this data might have changed. Because everything is matched to some certain databases has been created. And if you're going to get any new drugs getting started, then you should look into your database and understand if the drugs are safe for you, how you metabolize. If you're taking any pain medications, making sure they are not going to make you addictive to those pain medications. If you're taking antidepressants, want to make sure the right antidepressants, they're not going to cause you a certain harm. So all of those things are very, very important. We can talk about normogram, mentioned in the pharmacy booklet there, but why you want to become a number in a guessing game rather than know before you take any drug. I don't take any drug. I don't give any drug to my family without pharmacogenomic analysis done in my company. And we want people to have that access. We know that pharmacogenomics saves lives, reduces side effects, and personalizes treatment strategies. So your foundation starts from the whole genome analysis. If you have done once in a lifetime, keep the data, keep reanalyze the data. God forbid tomorrow you have some health issues, your family has a health issue, your daughter has a health issues. You can look into the data and see which insights you can get and how you can change the trajectory of the disease and get the right treatment strategy much earlier.
Absolutely. And address something for me, because this is something that I hear all the time, and patients are actually very uncomfortable with getting genetic testing and having their genomic pattern, DNA pattern or whatnot. And there was a recent company that was very popular for genetic testing that, went down, and the concern was my data. Where is my information going? And so how can I try to explain to patients the importance of it and the safety of it, and reliable companies and all. But how do you address that with patients that are concerned about their safety of their information?
Thank you for saying that. And being a doctor is very important that the patient's data should be kept private and secure. I know the company that went down, they did not have the whole snippets. They only had a small snippet of your personal data. Right. And that data still is valuable, but not as powerful as a whole genome analysis. Obviously, you have to look at the company if they declare upfront that your data will be kept secure and will not be shared with the third parties and will never be sold to anyone. For example, in our company, BioArrow, it's on our website. We don't sell people data. We are not into data selling business. The company that went down, their business was data selling to start with it. And this is how they made money. The business model was collect people's samples for various reasons, from ancestry to other inquiries people had, and then sell the data to third parties and make money from there. We don't do that. That is not our business. Our business is healthcare, empowering people, educating them, and making them the master of their own destiny. And I'll help them understand how they can save their data, how they can protect their data. If they want to store the data on a blockchain, they want a copy secured and sent to them, we'll facilitate all of those things. So ask the questions. What do you do with the data? Do you sell your data, my data, to the company, or company sells to someone else? Ask the questions. If you have any doubt, don't go to that company.
Absolutely.
And if they don't have a clear policies about your data privacy, don't go to them. And anyone honest person should be able to come on TV or come on the phone or have a policy declared on the internet, on their websites. And once you believe it, once you trust it, then go with them.
Absolutely. Thank you. I get that question a lot and a concern of that a lot, because genomic testing is getting broader and broader, becoming kind of a fast food business almost. Just get your genes tested here. We can tell you all about your health history and genetic history. It's very dangerous. So I agree. Please, we're going to take a short break. I've got a sponsor I would love to pay homage to for a moment, but I would really love for people to be able to look up your information. Can you give me your website and all where they can start studying?
Yes, the website is called BioArrow, BioArrow.com. And BioArrow also has a US FDA approved collection kits as a class 1. And for whole genome sequencing, exomes, microbiomics, skin, oral, vaginal, gut, and epigenetics, and many other tests.
Beautiful. I appreciate that. And of course, all of this information is going to be on my website, drpbetterlife.com, as well as all my other shows. I've been doing this for a couple of years now, and got over almost 200 shows, I think, now, and have enjoyed this one. And you have been a great guest today. And I'm going to pause for just a moment for our sponsor, and then we'll be right back and finish up. Thank you.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Everybody, welcome back. I'm Dr. Marianne Pinkston, and we are discussing with Dr. Kapoor today a very important topic about genetics, but genetics and cardiology, not only cardiology, but resiliency and longevity. And you've given a very, very dynamic explanation of why genetic testing is so important, why it's safe, especially through your company. And I appreciate all the information, but you mentioned something early on that interests me widely, and I think should interest everybody, and that is the microbiome. But most people really don't understand, the microbiome, and that's the growth of bacteria in your intestine and the balance of it and how it affects the rest of your body. The intestine is something we thought just had one job, and it doesn't. It has probably beyond the brain and the heart, I think, is the third most important organ in the body, honestly. So how does the microbiome affect your heart health?
Well, as you rightly mentioned, enteric nervous system is a very complex. In fact, it has equally or more nerve endings like a brain, and it's independent. It does work with our brain nervous system, but it decides its own way of working, and it gets influenced much, much easier. Look at the happy hormone, the serotonins. Over 80-90% is made in the stomach. We used to think it is made in the brain. And all the drugs which we take, antidepressants, they are targeted towards brain, where we only have a production over 10-15% of the supply. The rest is made in the stomach. And it's very, very important to understand how this microbiome and the microflora, think of this way, it's like your Milky Way. It's like your planets and stars, and there's so many out there. There's trillions of data sets which can be now sequenced using shotgun metagenomics. We can understand actually which bacteria that have been linked with various conditions, the colon cancer, depression, IBS, IBD, diabetes, various cancers, heart disease, and causing inflammation. So many of those things, those floras have been linked, and it all depends on in which quantity they are in. The way I describe to people is, think of this way. You have a lawn with the grass, and there's a good grass, there's a bad grass. And there's a small quantity, you may not get bothered by that. Right. But slowly by slowly start to take over your good grass, and eventually you'll try to bring in some insecticide, pesticides, trying to remove them with your hand, so make and protect your good lawn. Exactly the same way. So you have a stomach. In the stomach, or intestine, you have a bacteria and flora that is growing. The job is to protect you, help absorb the nutrients, and help regulate your hormonal health, reduce inflammation, and reduce the chance for developing diseases. But if you continue to eat the bad choices, the bad foods that encourage and feed the bad bacteria that have been linked for various heart conditions, diabetes, etc., they get empowered. Their numbers multiply. They take control and contribute into various disorders. And that's why it's very important for a diet perspective, has to be individualized. We follow gut microbiome-based diet. My wife is a dietitian, and our kids follow the same diet. And we know the impact happening. We find that we follow diet based on our gut microbiome. We are more energetic. We are more calm. We can have a better day. We are more focused, more output we can get done, and we don't take any regular medications, and we just follow the diet that is nurturing the good bacteria in our stomach. We have seen in our lab, and there are certain bacteria has been prevalent in certain populations who eat certain kind of foods, perhaps eating more red meat, no diversity in their diet from fresh fruits and vegetables. We have seen in those patient populations they have a higher chance of developing chronic conditions. We have seen they have a higher chance of developing coronary disease, depression, diabetes, cancers. We have seen patient population with IBS, with the gut microbiome, and lack of certain diversity that has been contributed into their anxiety, mental health, and many disorders they've been struggling with them. When our dietitians in our clinic, from a bio-gut clinic we founded in Calgary, when we introduced certain foods in their diet, they were scared initially. But after trusting our dietitians and they changed their diet based on the gut microbiome, their IBS symptoms got better, and they're able to tolerate food variety in a much better way. And we had some patients suffering from an IBS over 20 years. They've been graduating from the program crying that they could not believe in the 3 months of program with the BioGut Clinic, they could live their life again after 20 years. They were told to remove this diet, remove that diet, and when the diet was made based on their gut microbiome, and slowly but slowly diversity was added, they were feeling better, the symptoms are better. So that's where we realized there's so much power and the potential. We have the data. The most important data I always recommend people now in healthcare is the data you flush every day in the morning. So at least make sure you get a sequence once in your lifetime, if not more, and make sure you change your diet based on that.
Absolutely. I agree so much. And so the inflammation that's created from having the imbalance of the microbiome, the inflammation is key to so many chronic diseases. And in the cardiovascular system, please correct me if I'm wrong, I always told my patients, they ask about taking statins or taking medications for their numbers to lower their cholesterol and LDL. And I tell them, I said, it's really not about the LDL. It is in some cases, but it's really not about that. It's about inflammation in your arteries attracting the cholesterol to build up and cause disease.
Thank you.
Right? And so thank you. I something I try to tell people over and over and say, so let's go to the basis of inflammation. And that happens to be the intestine, the microbiome, where a lot of inflammatory disorders start, whether it's, autoimmune conditions and joint pain, or like you say, depression and other cancers. There's so many diseases, inflammation, and that's the key. And that's why I do think the intestine is among the most important of one of the organs, right?
It is. Heart attack is an inflammation disorder.
Yeah.
And heart attack is not a cholesterol disorder.
Yeah.
It's inflammation that triggers a plaque rupture, and it's inflammation that kills a person.
Yes.
So we have seen many times, many studies, many drugs have been shown to later on reduce inflammation. Look at statins. They were designed to lower the cholesterol. We found they have a reduction of inflammation impact. So that's why we start to believe they are reducing the heart attack and death rates in the patient population. We realize that, in fact, now semaglutide has been shown to reduce perhaps some inflammation markers. They're reducing heart attack in certain patient population. We have seen that as simple as a flu vaccination after a heart attack can reduce the chance of dying or having a recurrent MI or a heart attack just by taking a flu vaccination.
Wow.
It's inflammation is a killer.
Yes, it is. Ultimately, baseline right there. I think that sums up probably today's show and every other show that we've done. Inflammation is the killer, and your microbiome starts in your mouth and goes all the way down. So it's not just the intestine. It's very important. And if I'm correct, one of the first things that ever interested me as far as the microbiome and heart disease or even rheumatoid arthritis is some bacterial populations in the mouth. Is that correct too?
It is correct. We do offer oral microbiome tests. We have biodental kit, and people can get to know. And there are many bacteria has been linked with esophageal cancers, oral periodontal diseases, and has been linked with many disorders. Everyone should consider getting oral microbiome for sure. We also offer vaginal microbiome for women health, especially with vaginosis, infertility, miscarriages.
Yes.
There are so many other disorders, and getting not treated by doctors, by healthcare system, and doing analysis is very, very important.
Yes.
And understanding the diversity in the gut is important, which is a good thing. The more diverse the microbiome in the stomach is a good thing. You don't want diversity in the vaginal microbiome, because that's a bad thing. So, and we have seen the patient samples that women who are getting early menopause and their microbiome looks totally different than someone healthier and younger.
Wow, that is amazing. And I believe that heart and soul. That's amazing. So, having heard all of this, people are going to want to run out now and get their genomic testing done, self included. So where can we find this testing?
Well, we are a Canadian-based company, but we soon will be opening our lab in the Bay Area, San Francisco area, so people will be able to access services. Again, we don't sell people data. That is not our business, and your privacy is protected, and they can access services to BioArrow, BioArrow.com, and they're looking to get a service for longevity focus. The clinic is called Biongevity, BIONGEVITY.com. And if they truly want to know more about the gut health, so the clinic is called biogutclinic.com, and it's a dietitian-run program. And this clinic, people don't sell any supplements or nothing will be given to you, just working with you, with your behavior, with your diet, and empower you to make the rightful changes in your diet and feel strong and better.
Excellent. I love that. I love the no supplements. The supplements are great. It's something we sometimes need, right? And so, but if we could do this from a dietary aspect, and again, that might be another show at some point to discuss about, the changes in our foods and whatnot that have contributed, to some of this as well. But Dr. Kapoor, it has been such an honor to have you on. Thank you. Wonderful information. All of that information of where you can find all this testing and more information on Dr. Kapoor will be on my website at drpbetterlife.com. I invite you to come take a look, please. And go to YouTube. The YouTube link is there, and subscribe and follow us. And I really appreciate you being on. I hope for wonderful things for you, and I hope maybe we can have you on again at some point and discuss this further.
No worries. Thank you so much for having me, and happy to bring more ideas, more topics to discuss and spread the knowledge.
It's great. You're wonderful. I really appreciate you. Okay, everybody, I hope this has been wonderful for you as it has for me. Have a great week.
You've been enjoying The Better Life with Dr. Mary Ann Pinkston. For more information, go to drpthebetterlife.com. That's drpthebetterlife.com. And listen next week for The Better Life with Dr. Pinkston.